Hello and welcome to the recorded cohort for C159, Policy, Politics, and Global Health Performance Trends. I'm glad that you're able to join us for this. So the objective of the performance assessment for C159 is to develop a specific plan to advocate for the policies that improve the health of the public and/or the nursing profession. You'll develop a plan for both a top-down and a bottom-up approach, which we'll go through shortly, bringing the nursing perspective to policymakers and stakeholders. You'll identify the values and ethical perspectives that underpin your position and develop criteria to evaluate the success of your work. By the conclusion of this assessment, you'll have a plan for a policy change that can be sent to decision makers and a plan to work with organizations, community-based organizations, to promote policy change at the local level. The purpose of this task is to ensure that nurse leaders can use policy as a tool to advocate for change. The scope of your policy needs to be bigger than one organization, one hospital, one school, one business. This is not an internal policy that you're proposing. It's larger than that. So here you are, you've just started in C159 and you're thinking, oh boy, I need to come up with a great idea for my policy paper, but I don't even know where to start. Let's talk about some of the rules to guide you in choosing a topic. Again, it's very important that the topic has to be at a level that is bigger than your institution, okay? So no hospital policies here. Think state, statewide, county, city, school district, even if there's more than one school in that district, etc. We've seen some beautifully written papers on topics such as mandating safe nurse-to-patient staffing ratios in hospitals. Worked all the way through. However, if the scope was too narrow, if the student focused down too narrow, what would happen is they would really only propose safe nurse-to-patient staffing ratios at one hospital. That is too narrow for the scope of this paper. If you were interested in that topic, you would, at the very least, mandate safe nurse-to-patient ratios at the level of the state for all facilities across a state. You cannot select this topic for a state that already has this in place. For example, California. The state of California already has this in place. So you are going to propose something new. It doesn't have to be a brand new idea, but it cannot already be in place. Your policy idea needs to be about some kind of change for which you would like to advocate for. So it has to be a new idea or perhaps an amendment to an existing policy. Just as a quick example, smoking is prohibited in public restaurants, but you would like to have it expanded upon and be banned in all public parks. The topic can be about a population health issue. For example, mandating that people wear helmets when they ride motorcycles. Something that affects the global health of a population or a community. Or it can be about a nursing professional issue. For example, mandating that RNs have to take continuing education credits in order to renew their license. Here's another thing to consider. You have to have at least 2 recently published nursing research articles that support the need for this policy idea that you're proposing. Now, nursing research articles can come from nursing journals. They can also come from other journals. Maybe you find something in the Journal of Infection Control that has an RN, a registered nurse, as a contributing author. That would be fine too. They need to have been published within the last 5 years. So, how do you go about selecting a topic? So again, the topic of your paper should be one that improves the health of the public and/or the nursing profession. You can select any topic that impacts health or nursing as long as you can address all of the elements of the rubric. The topic that you select should be something that you're interested in because you'll spend quite a bit of time researching this issue from all kinds of different perspectives. Topics might include a focus on policy to impact public health issues such as childhood obesity, school health-related issues, communicable diseases, unintentional injuries, reproductive health, or any health issue that you think could be positively affected by a change in policy. Nursing profession-related issues might include mandating safe nurse-to-patient staffing ratios, minimum educational levels for entry into the profession of nursing, for example, a BSN, mandatory continued education units in order to renew licenses, mandating the amount of overtime a nurse can work, that type of thing. So your formal proposal could be at the local level, such as a city or a county ordinance. It could be the state or federal legislative level, could be a law, or at the level of a regulatory organization, such as a school board, Department of Health, that type of thing. So in your mind, you want to be clear as to whether you are proposing a policy or are you proposing something that you'd like to see turn into a law. If you're not sure about your topic idea and you are just wanting to bounce it off of somebody, please ask a course mentor. Please schedule time with your course instructor because we can help you. So, after you've selected your topic, you will then discuss what kind of financial impact this policy will have on healthcare organizations or the community. What's the financial impact of this policy issue specifically? Will the financial impact affect the healthcare system positively or negatively, or a bit of both? Will it be worth pursuing? Does the long-term impact of the policy change compensate for the upfront costs, including personnel time, data tracking systems, or anything else? How will the funding affect the policy? Is the funding even available? If not, where will it come from? So this is all the type of information that you're going to include under Section A of your paper as you introduce your topic. Talk about its relevance, why it's important, and the financial impact of it. So let's just go through an example. Let's say that your state does not currently require that RNs complete any continuing education credits at all in order to renew their nursing license. All they have to do is pay the fee, and they are good to go. Your issue is with respect to the fact that healthcare changes rapidly. So there's a concern that nurses in your state may not be up to date on the most current evidence-based practices regarding patient care. So your policy idea might be something like this. Nurses in the state of wherever, Colorado, wherever it is, should be required to document 30 hours of continuing education in order to renew their license. Your policy change might be something different. It might be at a local level, like a city or a county ordinance, could be at the state level, could be at the federal level, could be at the level of a school board. It all depends on the topic that you're interested in. So let's think about this. What would be the appropriate level in terms of a decision maker for changing a policy regarding required CEUs, continuing education units, for the renewal of a nursing license in a given state? Who would be the ultimate decision maker? Who could we bring this to say, I think in the state of blah, 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 all nurses must have 30 hours of CEUs in order to renew their license? Who would that go to? Who's the ultimate decision maker there for the top-down approach? That would be the State Board of Nursing, since they regulate and oversee licensure requirements. Okay, so that's who that would be. So that's the decision maker, depending on the state. There are several states where this is already in place. Some states still don't have this as a requirement, which is a little surprising, but they don't. You could even say, well, my state already has that. We already have to take CEUs. But I really think we should have to take CEUs on human trafficking because that's becoming such a problem. I would like to propose that in the state of blank, all nurses be required to take X number of hours, CEUs, on recognizing and reporting victims of human trafficking. That must be added to the mandatory list that we have to take. So, you see, this could be an amendment. You may already have to take CEUs, but not this one. You'd like to see people also have to take this one on human trafficking. So, again, for this, the decision maker will be the Board of Nursing. All right, let's talk about another example. Perhaps your state has no mandatory helmet law for people who ride motorcycles. And upon doing research, you know that 50% of all motorcycle accidents in your state involve riders under the age of 21. And perhaps you also uncover the fact that more than 25% of riders involved in motorcycle accidents end up with a traumatic brain injury and or die. They're fatal accidents. So perhaps your policy idea might look something like this. All individuals under the age of 21, both motorcycle drivers as well as passengers in the state of wherever, will be required to wear Department of Transportation approved helmets. Now again, you can only propose something like this if it's not already in existence. You can't propose something that's already been made into law. That wouldn't make sense, right? All right, so let's think about it. What's the appropriate level for proposing a change that requires all people under age 21 to wear an approved helmet when riding a motorcycle? Who would the appropriate person be in terms of approaching them to work on a policy change at this level? This sounds a lot like mandatory seatbelt laws. This sounds like it's going to be a law. You can work with a state legislator. You would want to do some research and select somebody that has an interest in this. You can click generally on biographies of your state legislators, and you can see what committees and subcommittees that they've been assigned to, previous work that they've done, and likely you're going to pick somebody that's already on a Department of Transportation type of committee that you would pair up with, that you would state that you would pair up with them. If this is going to become a law, you're proposing it as a law, you can work with your state legislator, but you'd want to be sure to include some verbiage about the fact that ultimately this type of topic or proposal would be brought to the governor of the state, name that person by name, for consideration, where they could either, approve it or not. So again, you can work with a state legislator, but you would want to indicate that you are aware of who the ultimate decision maker is, where it's going to stop in terms of gaining approval. So the top-down approach essentially is one where a person or a government entity or a regulatory agency, some sort of authority, sets a policy and expects compliance. It is an authoritarian approach. You should be sure that you understand and can demonstrate that you understand in your paper the steps necessary to formalize your policy proposal from the top-down approach. Keep your rubric handy and demonstrate that you understand, for this example, all the ins and outs of the legislative process. And again, this is going to depend on the level of your policy, right? So if you need to know what the steps are to get a bill into a law, that's something that you're going to need to explore and examine. If you're proposing a regulatory change, what steps are needed to have a policy approved? Does the agency require public hearings or board approval? For our example with the mandatory CEUs in order to renew your nursing license. That's something you'd have to explore. How does the Board of Nursing in your state make these types of decisions? Now, just as a quick example, and you can always pause it here if you decide that you are in fact going to go with proposing a law. Here's a little graphic that outlines how a bill becomes a law at the state level. Okay, so this I thought it would be very helpful for you if you were going to go this route. When you select a decision maker, again, for this top-down approach, you need to select a specific person and identify them by title and name. This is someone who can endorse the policy and move it forward through the formal approval process. So, to identify your decision maker, you're going to analyze your proposed policy. Why would this person receive the policy brief? Why would it require their attention? You are also going to discuss what challenges the decision maker could face in gaining formal approval. Not generic challenges, specific challenges for the decision maker. For example, are there groups that might oppose this policy? Are there budget constraints? You want to identify what the options and alternatives are for the decision maker. What alternative policies could they consider? Why are you recommending your proposed policy as the best option? What steps should the decision maker take from here? Again, from their perspective. You will then propose a persuasive course of action for the decision maker. How can the decision maker be prepared to address the challenges? Challenges are under section B2. So for every challenge that you mention, that would be a potential challenge for the decision maker, under B4, you need to discuss a persuasive course of action, a concrete course of action for the decision maker. How would they be able to address each challenge that you were listed that they would potentially encounter? From there, once you've worked your way all the way through the top-down approach, section B of your paper, we get into section C, which is called the bottom-up approach. This is also known as the community-based participatory approach. And it's an approach where those who are impacted by the issue, usually the stakeholders, collaborate to develop and support a policy rather than being told what to do. The community-based approach generally uses strategies such as outreach, education, advocacy with stakeholders in order to gain support for a policy change. Both of these approaches can be effective in terms of implementing change. In this paper, you are asked to discuss both of these approaches, the top-down, which is B, and the bottom-up, which is section C of this paper. The ultimate desired outcomes for each approach are the same, to positively impact the health issue. So for the bottom-up approach, you're going to identify an organization or community group. It could be a professional association, a community group, as I mentioned, a local organization that's committed to the issue. And you want to identify why this organization or community is interested in your topic. This needs to be supported with evidence, such as media, newspapers, magazines, discussions, policy briefs, that type of thing. So you want to discuss and describe how you know for sure that your partner organization, community organization that you have selected, has goals that are similar to the goal of your policy. Have they done this kind of work before? Is there something in their mission statement that demonstrates this goal alignment? In their vision, have they conducted workshops on this already? That's the type of thing, and you of course need to be sure that you cite that. Discuss how 3 community-based participatory research principles could be used in your collaborative work with this group. We'll go through those shortly. What is your plan to approach and collaborate with the organization or community group? Describe how you would approach this group that you've chosen as your collaborating partner. Who would you contact? How would you ask for their support? How will you recruit volunteers from that group to work with you on this policy change? How often do you anticipate meeting with these group members? Consider this not just a global overview of your topic, but this is really a mock proposal. Please include substantive detail under every section and every subheading of this paper. The CBPR principles can be found in the course of study in the following document, Promoting Healthy Public Policy Through Community-Based Participatory Research, 10 case studies. And once you get into this document, it's in the course of study again. I'm sure if you can't locate it, you can email your course instructor and they can send you a copy of it. It's a PDF. Once you get to that document, on page, I believe it's 13, of the document, you'll find this box. It's got the 9 principles of community-based participatory research. And I think what we'll do, just to be clear on these, is we'll go through each one. So for number 1, CBPR recognizes community as a unit of identity. This involves a sense of emotional connection and identification with others, shared norms and values, common language and customs, similar goals and interests, and a desire to meet shared needs. Communities of identity may be either a defined geographic area, like in a neighborhood, or a geographically dispersed group with a common sense of identity, for example, an ethnic group or an age group or sexual orientation. A city or other geographic area may include a number of different communities of identity, or may be an aggregate of individuals who do not have a common sense of identity. CBPR partnerships seek to work with existing communities of identity and or to enhance a sense of community through the collaborative process. There also may be situations where communities of identity may benefit from involving individuals and groups from outside the community of identity who bring additional needed skills and resources. CBPR builds on the strengths and resources within the community. Such strengths and resources include things like the skills and assets of individuals and families, the caring and helpful networks of social relationships, and the mediating structures such as faith-based organizations and community organizations. These are the types of groups that enable community members to work together to improve health and quality of life. CBPR facilitates collaborative, equitable partnership in all phases of the research. CBPR projects are conducted according to the norms of partnership, and this includes mutual respect, recognition of knowledge, expertise and resource capacities in the participants in the process, and open communication. In CBPR, to the extent desired, all parties participate in and share control of overall phases in the research process, including problem definition, data collection, interpretation of results, and application of the results to address community concerns. Researchers involved in CBPR recognize the inequalities that exist between themselves and the community participants, and therefore pay explicit attention to the expertise of community partners and the need to create an empowering process through sharing information, decision-making power, and resources among members of this partnership. CBPR promotes co-learning and capacity building among all partners. CBPR facilitates the reciprocal transfer of knowledge, skills, and capacity. For example, researchers learn from community members' local knowledge about their community's history, culture, and broader social context, as well as from their administrative and management skills. Similarly, community members learn further skills in areas such as how to conduct research and how to propose a grant. CBPR integrates and achieves a balance between research and action for the mutual benefit of all partners. We seek to build a body of knowledge about health and well-being while also applying and balancing the knowledge generated with community and social change efforts. CBPR partnerships may agree that all research efforts do not have to involve an intervention component, but they may commit to the translation of research findings to intervention and policy change strategies that will address the concerns of the community. CBPR emphasizes local relevance of public health problems and ecological perspectives that recognize and attend to the multiple determinants of health and disease. That's a long one. An ecological approach involves individuals, the immediate context in which they live, for example, family or social network, and the broader context in which they are embedded, for example, their community or society. Accordingly, this ecological approach attends to the multiple determinants of disease and well-being, for example, biomedical, social, economic, cultural, and physical environmental factors. CBPR involves systems development through a cyclical and iterative process. The new issue or problem may be different, and the learning gained from each stage is used to sustain the work that was implemented or the change that was created. Iterative in relation to a project is the researchers and the group's cognitive review of the current data and processes to evaluate and reflect on their appropriateness and acceptability to the partners before continuing to the next planned step or phase of the project. Also, the researcher must allow for the time-consuming process. The iterative process is time-consuming because it involves reflection and acting while simultaneously building allies. CBPR disseminates findings and knowledge gained to all partners and involves all partners in the dissemination process. CBPR projects produce, interpret, and disseminate findings to community members in clear language that's respectful to the community and in ways which will be useful for developing action plans that will benefit the community. The dissemination of findings is provided on an ongoing basis using multiple strategies, and the results are used to guide the development of interventions and policy change. The dissemination of findings extends beyond the partnership itself and involves all partners as reviewers and co-authors of publications and co-presenters at conferences and workshops. CBPR involves a long-term process and commitment. It emphasizes the establishment of relationships and commitments that extend beyond a single research project or funding period. CBPR is conducted in a way that strengthens ongoing collaboration among community-based organizations, public health agencies, healthcare organizations, and educational institutions. Evaluation of the process for each approach, the top-down and the bottom-up, is a bit different. In the top-down approach that you discuss in Part B, you want to focus on the steps that need to be achieved for the proposal to become a formal policy. For example, did the decision maker agree to move the policy forward? What was the next step? Was it successful? You want to basically, when you're talking about evaluating the success from the top-down approach, because you'll basically have to do this twice. You'll have to evaluate the success of the policy brief from the top-down perspective as well as from the bottom-up perspective. So let's talk about how to do that from the top down. You're going to identify process successes, which are little successes from the top down approach, as well as big successes or long-term successes. So a process success or a little success, a little stepwise success, these things happen at every stage of the policy process. So if you're trying to get a law passed, for example, your first success would be when a legislator agrees to even sponsor a bill. The next process success is when it passes committee hearings. A long-term success is what you'll describe, you anticipate happening after your policy is implemented. So after your policy passes, what would be different? So for example, if you were changing childhood immunization schedules, a long-term success of that might be something like, 1 year after the new immunization law is passed, the incidence of vaccine-preventable illnesses decreases by 20%. Now, when you're evaluating for the bottom-up approach, those types of successes, you're going to evaluate the action steps, the things that you did. If one of your action steps was to hold a town hall meeting or conduct a town hall meeting, you might evaluate the number of people who attended these meetings. A town hall meeting is not very successful if nobody shows up, right? So perhaps part of this involves just taking attendance. If it's a webinar, how many people logged in? How many people were actively engaged in the chat area? How many groups or individuals agreed to support your policy change? That type of thing. So you are going to evaluate the success from the top down as well as the bottom up, because they are two different approaches. Now, for Part D, you're going to examine the strengths as well as the challenges of each approach. And then you are going to compare and contrast them. Of course, there's always advantages and disadvantages to each approach. For the top-down approach, just as an example, The advantage of the top-down approach is that, this is just speaking globally, you'll want to, of course, tweak this to and refine it to your specific topic. But in general, the advantage of the top-down approach is that decisions can be made and implemented very quickly. This is particularly important when time is limited. The other benefit of this approach is that it can help align project goals with strategic goals. It has direction. It's done fairly quickly. A disadvantage of the top-down approach is in that because there's not really team involvement per se, lots of layers of people might feel left out, as if they can't voice their opinions. You don't have as much buy-in that way. Now, in terms of the bottom-up approach, again, there are basically advantages and disadvantages to that, and some global ones, some general ones would be, in terms of the advantage of the bottom-up approach, is that you've got team members, you've got larger numbers of people who are actively working on the project or the policy proposal that feel that they have a say in this, and decisions tend to be made collaboratively. This will improve team communication and team building. It empowers team members. As a result, that often motivates people to do their best to achieve the goals of the project. But some disadvantages could involve, because anytime you're working with groups and lots more people, this can be very time consuming and require much more effort as compared to the top-down approach. Sometimes bottom-up approach, it may not be suitable for time-sensitive projects. Bottom-up approach, it really requires a clearly defined scope and control of processes. Otherwise, you kind of can risk getting out of control. So, in summary, just to wrap it all up, in the first section of your paper, Part A, you'll write about your issue that's of interest to you, how it impacts nursing as a discipline, or how it impacts health outcomes for patients or a population. You'll analyze the issue and you'll provide rationale for why this is an important issue. For Part B, you'll develop your policy brief from the top-down approach that we spoke about. And generally, this would be through a rulemaking board, a regulatory organization, or a legislative process at the local, state, or even national level. Then for Part C, you'll consider a community-based participatory, otherwise known as bottom-up, approach. You'll select an appropriate group to collaborate with to positively impact the issue from the ground level. The group might be through a coalition with your healthcare system, a group of nurses from your state nurses association, or some other professional or community group who come together to collaborate on this. Just as a quick example for mandating that motorcyclists have to wear helmets in whatever state. A state level group that you might collaborate with for your topic might be the state association of neurologists and neurosurgeons, or emergency physicians, someone who sees these types of injuries, or there may even be a state traumatic brain injury association that would be on board with helping you to push a proposal through. In the final part of your paper, Part D, you'll discuss the strengths and challenges of both the top-down and the bottom-up approach, compare and contrast. You'll make a recommendation for which approach you believe would be the most effective in terms of implementing a change. There's no right or wrong answer. It all depends on what you uncover during your research, and it's really related to your topic. Here's some final tips. Create headings and subheadings in your paper for each section of the rubric. Use the ones that are already in the course of study and already in the rubric. Please don't make up your own subheadings and headings. Use the ones so that there's consistency. And don't leave them out. It's entirely where there's no headings. Please do that. Please be sure to read the rubric carefully and address the criteria specifically, concisely, and thoroughly. Use the C159 resource document rubric tips located in the course of study to understand each section of the rubric. Analyze how your values and goals apply to your topic. Remember, when choosing a topic, consider a topic that you're passionate about because you're going to be doing a lot of work on this paper. And think in terms of advocacy. As a nursing leader, how will you convince others that your issue is important and deserves attention? How can you use evidence to support the need for this policy change? Thank you for attending this recorded cohort for C159. I do hope that you found it to be helpful.